Good morning, everyone. I am Brian from Midwest Family Lacrosse, broadcasting live on several of our stations this morning for the second day of the Children's Miracle Network Radiothon. This is our first year. Thank you very much. All right, cool. Well, my work's done here. I'll see you. I'm just kidding. But no, it's day two, and today's sponsor is the Oral Surgery Clinic of La Crosse. Of course, our other great sponsors are Stanek Electric and Mark Jewelers. Big thanks to them. And I'm sitting here with Rena Cash, who is the program director for the Children's Miracle Network here at Gunderson Health System. And what does that job pay? Is it good? Because everybody's paying really well right now. Are you getting some serious cash for this job?
We're doing okay.
You're doing okay. All right. But
it's nonprofit work, but we're doing okay.
But I mean, this is a heck of an undertaking. I mean, this is wild. There's, a huge bunch of tables over here for people to call in. If they want to donate, they can call 784-KIDS. That number is up and running again today. 5437. First person to call in today and donate, I'll sing your favorite song, and you can listen to that on one of our three stations that we're broadcasting on, or you can watch me sing it live on the stream at Around River City. Yeah, right. I'm a giver. That's what I do here. You can also text in a donation to CMN Kids. That's all one word, if you will. CMN Kids to 51555, or they can donate online at aroundrivercity.com or go to gundersonhealth.org/radiothon. Now, Rena, let's have like a real nice in-depth look at what CMN Kids does. I know that maybe some people know, but maybe a lot of people don't know. What do you guys do? When we talked to you on the phone the other day, I thought your phrase from colds to cancer was great, and that's truly what you guys do.
Yeah, I mean, we are there for families at any point in a child's life. So we try to be there for when they're born, whether it's in the NICU or anything like that, or making sure they're getting preventative care. So we're helping kids both in and out of the hospital setting. So we're paying for equipment for our hospital, so that way we have the top technology available when families need it, should they ever need it. And we're also there with training our pediatricians and stuff like that, so that way they have the most up-to-date knowledge to ensure that we're giving the best level of care for kids. But we're also out in the community because we realize that's really what our donors want to see,
right,
as well, is that I feel like we have an obligation to be there, for families, because so many of us are in the same boat with our insurance. Insurance drives where we get our care. So we need to be out there, feet on the ground, helping families in our community, because kids that are dealing with medical conditions, it doesn't stop when they leave our building.
Right.
So, kids with diabetes, need insulin supplies and pumps, or kids need hearing aids. Cancer patients need support. So we're there, and families can apply for funding with us through our online grant application process. And they can get funding for all of these things. So we do even some pretty unique things in our community recently that a lot of people probably don't even realize. Things like we do disaster support now. So families that are victims of fires, floods, they can apply for some funding for us, so that way kids can replace their toys and their blankets and stuff, because most of us as parents or adults, through those tragedies, we're worried about, food, shelter, those basic necessities. Where kids, their security comes a lot in their favorite toy or their blanket, or teenagers, it's their clothes and toiletries.
Their phones.
Yes,
Phones,
so we're like, or even replacing medications,
Oh my goodness.
And we want to be there and help those families, because, I mean, for kids, being able to replace a toy, that's everything for them in that moment. And a fire or anything like that is pretty tragic as it is. So being able to offer them, gift cards, so they can go purchase those things is big. We were just talking yesterday after everything kind of shut down, is one thing we don't talk about a lot in our community is, we always talk about, like, through these events, all the happy stuff, all the amazing things that we do. But then there's a whole side of it of, not every story has a happy ending, and some of our kids don't make it, but we want to be there.
Right.
So we help fund funerals and bereavement support for families. So families can get a fingerprint charm, and they can turn it into a special necklace or a keepsake of their child, so that way they always have that. We've done funeral support for families because we just don't want them to have that bill.
Yeah.
And yeah.
And I think it's important too when we've worked with so many families over the years on our radio station, and you talk about okay, maybe one child has medical issues, but then there's 3 or 4 other kids that are in the family, and then there's meals that need to be made, or there's groceries that need to be bought. There's all these things that we take essentially kind of for granted. Like, I got to do the laundry, or I got to mow the lawn, all these things that need to happen, but your focus is completely on that child who's either in the hospital or dealing with a severe medical issue, and you guys can help alleviate some of that stress, even if it's just on a day-to-day basis.
Yes, it is. We're all about helping the whole family, because you're 100% right. When there's a kid going through a medical experience, they require a lot more extra care and from the family. And, as so many families say, that's, not to be a negative thing, but it's a financial burden on their families. And worrying about paying your bills or buying your groceries or putting gas in your car. Or even here in the hospital setting, we have families that come in. Well, pre-COVID, we had families come in with their siblings. So we even help support like our child life areas with sibling bags, or our pediatric areas. So that way when one kid is in the hospital, there's something for that other child to do, because we never want them to feel left out, as it is a child's medical experience impacts the entire family.
Well, and as you mentioned, those, on the other end of the spectrum, those sad stories where tragically it ends, in death or whatever. But what an awful time to have to try and figure out, how am I going to pay for a funeral, and where am I going to get a casket? Where am I going to get a great, all these things, and what a great weight off your shoulders if Children's Miracle Network is able to take care of some of that for people.
Yes, and sometimes it's kind of a surprise. We have an amazing, I always call her our hidden weapon, Karma, who is our social worker. She processes all these grants, but she even notices, like in the obits or something, or even from the other social workers, that a child isn't doing well or the prognosis isn't good, and she'll like go in and contact the funeral home. And there's times we've paid for stuff, so the family never sees a bill. They don't even see it.
And that's awesome, because then that stress is completely gone.
Yes.
And you can focus your attention maybe on the remaining children, or grieving properly, going through that process, as opposed to, how am I going to now pay this bill? How am I going to now deal with that? So Children's Miracle Network does so many great things. The Radiothon goes on all day today from 6 a.m. till 6 p.m. I think we just got a call on somebody. We need a big day, so we need more calls. Did I hear Dancing Queen? Is that what I heard? We've got the amazing team over there taking the phone calls. Big ups to those guys for donating their time and taking the phone calls. Again, if you want to call in, 784-KIDS-5437, or text in CMN Kids to 51555. And what do we got here?
We have a request
for
you to sing Dancing Queen.
Dancing Queen.
This is on a donation from Lori.
From Lori. Oh, geez. I wonder which one of the 8,000 Loris that I know this is from. I'm guessing it's Jean's Lori. All right, and her big purse. All right, here we go. I might need a feed of the lyrics here. I know the hook. I'm not sure if I know the verses, but see that girl, watch that scene, digging the dancing queen. Come on, Rena. Come on, join me. Ooh. No? Was that good enough?
You're flying solo on this one.
Big money. There you go. This is the kind of thing you're going to get today. Or you could call in and pay to have me stop singing. That would be another thing. But the Miracle Room here, by the way, sponsored by Ultra Federal Credit Union. The family interview area is sponsored by Team Marine. Big thanks to those guys. Of course, also our great sponsors, Mark Jewelers and Stanek Electric. Rena Cash with me here, the director of the program. Tell me about this $50,000 giraffe thing, because I had no idea that thing was $50,000. I mean, that's a huge amount of money, and that's just one machine. And how many of these does the average hospital the size of Gunderson Health System?
Yep.
You said there's 8 right now?
We have 8. As of yesterday, we had 8 babies in the NICU right now. So these are 8 babies that rely on things like our isolate over there to keep them alive and give them a perfect environment so they're doing okay. So yeah, it's a $50,000 piece of equipment, and every year we try to replace one on our unit to ensure that we have the best equipment up there available. Right. And we couldn't do that without the support from our community, because when we are able to purchase those pieces of equipment, that frees up money, so that way the hospital can do other things as well. So we really rely on philanthropy to help support some of this equipment and training and things that we do in our area. So
Yeah, these are just some of the machines and some of the things that cost money. These diapers here are not very expensive, but they're very small.
Yes.
And this is the size of a diaper that goes on an average NICU child. And if you are aware of this, these things are what, 50 cents a piece, I
Yes.
believe. But I mean, imagine having to have a diaper on your child that's this small and having to go through that, and then have them in the giraffe machine and all the other things that. Of course, happen when your child's in the NICU. But we're not just talking about NICU children either. You guys obviously are involved with children who are dealing with all sorts of different medical issues.
yes, we help kids with just a variety of conditions like diabetes. We help kids that are on the autism spectrum. I know that's something that's really personal for me, is having a child that's on the spectrum. So that was really wonderful. We help kids with medical complexities. There's so many kids that just have a variety of different conditions that are going on. And it's just awesome being able to be there. Kids with cancer, I mean, you name it, like, we're there.
Well, if you guys want to donate to the Children's Miracle Network Radiothon today, you've got until 6 p.m. You can call in anytime. We've got people on the phone, 784-KIDS 5437. You can text in. Obviously, we're on our phone all the time. You can just really quick text CMN Kids. That's CMNKIDS, all one word, no spaces. Text into 51555. You get a hyperlink, and then you can donate on your phone. You can also donate online at aroundrivercity.com or go to gundersonhealth.org/radiothon. You can watch live me and my beautiful Hawaiian pink shirt for October, being Breast Cancer Awareness Month. Fellas, wear your pink on Fridays. You can watch us at aroundrivercity.com. And again, if you want to call in and donate this morning, I will sing your favorite song. I may not sing it well. I may not sing much of it, but I'll sing it for you, just like I did with some Dancing Queen, if you want to call in. And again, big thanks. Who's bringing breakfast? Because I was in the room and I saw some food, but we got breakfast coming. Is it Harvest Bread and Subway bringing breakfast this morning? Is that who?
Ooh, they
McDonald's?
did it yesterday.
Okay.
Today is Mickey D's.
Mickey D's. All right. Our good friends over at Courtesy Corp going to be supplying food for our great staff here that are taking the phone calls. And Rena Cash, where can people go for more information about Children's Miracle Network? Obviously, they can go to gundersonhealth.org, but like, where can they go can they call you? Can they go to a website? Is there some way they can get more info if they need help?
Yes, so they can go find us on gundersonhealth.org, CMN Hospitals, or if they just Google CMN Hospitals in general, it actually, National has it set up so that wherever you're going from, it directs you to your local CMN hospital.
Yeah, I noticed that when I typed it in yesterday.
Yes.
It's sort of location knows exactly where you are.
Yep,
And then,
so they know where you are, and that way you can reach out, get a hold of us. You can email us at cmnhospitals at gundersonhealth.org, or you can give us a call at 608-775-4424 to learn more about us, as well as if you need help.
And one thing that we talked about the other day that I thought was really interesting, and Gene mentioned this to me as well, was that we're obviously broadcasting live from Gunderson Health System, which is where you guys are based out of. But it's not just a program for people who bring their business here. We're talking about throughout the Cooley region, people who in the La Crosse area are at a different medical facility. Maybe they can also take advantage of those programs.
Yes, that is one thing that's really unique. So there's 170 CMN hospitals across the nation, and we are the only CMN hospital that helps kids no matter where they get their care. So as long as they fall within our 25 county service area, we're able to help support them in some way, shape, or form. So they can apply for funding just like anyone else in our community can and get support.
Thank you so much, Rena Cash, joining us this morning. We're going to talk to some of the families. You're great. It's so easy to interview experts because I don't have to lead them along. They just sort of answer the questions for 10 minutes and I just sit here and look stupid. But no, seriously, what a great organization. What a great radiothon we're having. Yesterday was great. Today, hopefully the same thing. We're going till 6 p.m. You can donate again online, aroundrivercity.com. You can watch the stream there as well as our Facebook pages. Big thanks to all of our great phone staff who are here this morning. Please call in and donate 784-KIDS, even if it's $5, $10, $20, whatever it is. We appreciate your business. We appreciate your money. It's going to go a long way. And big thanks again to our sponsors, Mark Jewelers, and of course, Stanek Electric. Rena, been great.
Thank
It's
you.
the CMN Radiothon, the Children's Miracle Network Radiothon on Midwest Family Lacrosse.